As parents receive a diagnosis of autism for their child, and thinking about the kinds of things that they can do, first of all, they ought to look to providers who provide for treatment, provide evidence-based treatment, and try to be driven and guided by the principles of science, if you will, as it relates to that, so as to avoid some of the quick cure sort of treatments that are available on the internet. As the numbers grow, more and more people are preying on parents, and it's a very difficult, slippery slope, if you will, to getting the most effective treatments. So look for evidence-based treatments. My bias is applied behavior analysis is the treatment of choice, and I would recommend parents look in that direction. In addition, I think parents are the child's best teacher, and as a result, for the parent to receive as much training as possible in how to help their child develop, and in many cases to manage the difficult situations in their life, such as going to something as simple as going to a grocery store, going out to movies, going to restaurants. Many parents, unfortunately, become shut-ins as a result of these difficulties, and I think parents should be made aware of the fact that many of these problems can be overcome with effective parent training and involvement of behavior analysts. So if there's a message of hope, it's the idea that while your child has a disability, and it may be a lifelong disability, there are many, many treatments that can be effective and can lead to you and your child and your family living a more typical sort of way of life, despite the challenges that you'll face.